Hello, my name is Enoch Mwasa, fourth year student of physiotherapy here in Mawadi University. In this video, we'll be looking at the assessment of cranial nerve number 9, 10, 11, and 12. So this is the glossopharyngeal, vagus nerve, spinal accessory, as well as hypoglossal. So when you look at the glossopharyngeal nerve, it's a mixed nerve, which is having the afferent and the efferent. So basically the glossopharyngeal and the vagus nerve, which is the 10, 9 and 10, they are basically assessed together. So when you talk about the glossopharyngeal, for the efferent of the glossopharyngeal, it supplies the test from the posterior side of the tongue, and also the test from the posterior side of the tongue, as well as the sensation from the oropharynx. Now, when we talk about the efferent of the glossopharyngeal, it basically supplies from the salivation. It's basically deal with the salivation. Now, when we talk about the vagus nerve, the afferent part of the vagus nerve it supplies the thoracic as well as the abdominal viscerals. So now, when we talk about the efferent of the vagus, it usually supplies to the larynx and the phalanx of the muscles, as well as it helps also. It also supplies to the other parts of the abdominal and the thoracic. So these basically they are being accessed together. So the first assessment you can ever have is to ask the patient to say a word. You observe from the hoarseness of the voice or the dysphagia of the patient. So please, what is your name?
My name is Nana.
So from the voice itself, you can tell whether something is wrong or not. And the other assessment, you can ask the patient to open the mouth and ask them to say ha. So when they say ha, you observe the lining of the ovula. When there's a problem in the vagus or the glossopharyngeal, the ovula will diverge from the side of the lesion. Then when we talk about the same ha sound, you observe the elevation of the parrot. If there's any problem in the parrot, then you observe the movement of the parrot. Then the other assessment is called the gag reflex. A gag reflex is just a reflex that like somebody is abstaining from the food to enter through the throat. So what we normally do with the gag reflex, we have something like maybe we can have an ice cream spoon or the wooden one. Then we ask the patient to open the mouth. Then we put it inside. So inside there, it will observe that as if somebody wants to vomit. It will show that is a gag reflex. And the other one, you ask the patient to just give them a simple food. When you give them the simple food, they will fail to swallow. So it will show from the throat to say they're failing to swallow, meaning they are having a problem with the glossopharyngeal and the vagus nerve. And the other part is where now you introduce, since it's supplied to the posterior tongue, so you just give anything like bitter or lemon to the patient. So when you give them something like bitter, then you ask them if they're able to taste anything. That is the assessment for the glossopharyngeal as well as the vagus nerve. Now the other one which we have, which is the 11th cranial nerve, which is the spinal accessory nerve. This spinal accessory nerve is basically deal with the head movement. It's applied with the sternocleidomastoid muscle as well as the trapezius. So I'll first start with assessing the trapezius. So I'll palpate the trapezius, then I ask the patient to shrug the shoulders against resistance. So please, can you shrug the shoulders upward? So in this case, I have observed that it's not having problem with the trapezius. So I'll go to the sternocleidomastoid muscle. So I ask him to do the movement and I will pause the movement. Please do the movement. Alright. So from this side, I can see there's no problem. Then I have to do it bilateral on the other side. Okay, do the movement. Alright. On the other side also, there's no lesion detected. So that is the assessment from the spinal accessory cranial nerve. So now we'll go straight to the last cranial nerve, which is the 12th. This is hypoglossal. This hypoglossal applies to the movement of the tongue. So sometimes we normally have what we call flaccid paralysis of the tongue or spastic paralysis of the tongue. So when we talk about the flaccid, then we ask the patient to protrude the tongue. Can you move it sideways? Okay, again, this one, upward. and downward. So when we look at the protrusion of the tongue, in the flaccid paralysis, the patient diverts the tongue towards the lesion. In the spastic paralysis, we normally see the movement of the tongue. It's a diverge from the opposite side of the lesion. So this is the assessment of the 9, 10, 11, and cranial nerve. Thank you.